this is truly scary and nobody is taking it seriously. I want to jump through my phone and strangle people that are on the beach or out with their friends still. Like you guys, that's the problem, right? And
it is for real out here. When I say it's for real, it's for real.
Is Jenny Omani. I live in Vancouver. I'm obviously part of Team Glow, and I'm a registered nurse. I'm actually one of the educators in the intensive care unit at Vancouver General Hospital. And I'm coming here to tell you, please stay home. Please stay home. The only thing that we can do right now is stay home. Okay? It's so, so important. I don't want to scare you guys, but this is a very real situation. This is really, really real. This is very, very serious. And if you think that Italy is not possible for us in North America, you are dead wrong. Okay? It is very possible for us to have that happen. And to be honest, we're on that trajectory. If you self-isolate and stay in your home, this disease you can 100% avoid it if you are staying inside and staying in your home and only going out to get groceries. And when you come back, you take your clothes off, you throw them straight in the wash, and you go have a shower. Yes, I'm serious. I'm actually shaking. That's how serious I am right now. I've heard of several people today tell me they're going on road trips, and all I can think about are my coworkers who are having panic attacks before they go to work. They have been told that there's almost a 100% chance that as frontline workers, they will catch the coronavirus. These people all have kids. They are you and me with medical training. And they're terrified, and they need us to stay home. It's okay to be scared. Like you said, Kim just said here, fear is okay, we need to wake up. Yes, we need to wake up, guys. So I'm actually here begging you to stay home. And if you know me, you know that I don't cry. But thinking about my friends at the hospital right now is breaking my heart. And there is a very real chance that I will be called back from my maternity leave and have to go to the front line in the ICU and look after these patients. And then I need to decide whether it's safe for me to come home to my children. And I don't know the answer to that right now. I have friends sleeping in their garages because they don't want to go in their home. So please, if you think that this is all an overreaction and hype, you're wrong. And I hope that you listen to somebody who's telling you this. Stay home so that you can protect the people who can't. Because there are people who can't stay home right now. They don't have that choice. So if you're electively leaving your house to do things, you are, in all honesty, and this is like a smack in the face, you are contributing to the death rate.
My people, citizens of Mobile, Alabama, it is for real out here. When I say it's for real, it's for real. People is dying, dropping like flies. That lie they telling about old people and all that, no ma'am, no sir. Young people, 30-year-olds, 20-year-olds, 19-year-olds. I just was in the ED and we intubated 4 people within 30 minutes. We had a gunshot victim today who came in the hospital, and she was on quarantine. She had tested positive and was home on quarantine and got shot. This is crazy. Everybody got it. We can't go out the door, period. We can't go outside. It's so for real, y'all. Patients who need to be in the hospital for other things other than the corona, they can't come to the hospital because the corona got it sold up. It's like a real epidemic, a real pandemic, just like they say. The news is not doing this any justice. Like, they need to take the camera and go in the hospital.
Most of you do or don't know, I'm an emergency room nurse and have been working on the front lines of this coronavirus for the last 10 plus days. And I'll have to admit, in being totally transparent, that if you would have asked me 10 plus days ago if I thought that this was going to get as bad as it was, I would have told you no. I mean, you heard the rumors, you saw the trends, but until you see it firsthand, you just have no idea what it's like, what it's going to be like. Coming into the hospitals is not going to benefit you unless you really are having respiratory distress. And that's what we're starting to see now, is the people who didn't follow the guidelines to quarantine from the beginning. And we're starting to see people coming in. And last night was, I don't want to say my breaking point, was my reality check in regards to what happened. I was sitting at home on my first night off, and my boss texted me and called me and said, hey, they really need help in Southfield in the emergency room. Everybody's sick. They're intubating everybody, and all these patients need help. So, of course, we got up without any sleep and went and worked a night shift until 7:30 this morning with some of the bravest coworkers I've ever met in my life. My friend and coworker Laura and I went there as Novi representatives to help the Southfield staff. And there's nothing to describe what happened there. It's getting to the point now that we're going to be just like Italy. We intubated from 10 p.m. last night until this morning. We intubated 2 of my patients within a half hour. And I would say upwards of 10 patients were put on ventilators. My patient took the last ventilator available in the hospital at 7 a.m. So what does that mean going forward? Resources are very slim. We have no medications to keep these patients even ventilated, let alone ventilators. Medications like fentanyl or propofol that would keep a patient sedated while they're intubated, we're out of. We're out of Tylenol. We're out of Tylenol. And that's not even going back to the fact that we don't have any ventilators to put these patients on. So we're going to start making life or death decisions in regards to people's care. This is truly scary, and nobody is taking it seriously. I want to jump through my phone and strangle people that are on the beach or out with their friends still. You guys, that's the problem, right? And this is what they give us. So this is actual real life in the hospital now. They give you a paper bag and they give you your N95 mask, and this is signed out for the entire year. This is what I have to go into patients' room with, and then this is what at the end of my 12-hour shift I put into this paper bag and bring home with me, and I have to bring it to and from work every day. Do you think that sounds safe? Because we are completely out of resources. There are no masks, there are no gowns, we're running low on gloves because everyone has panicked and stockpiled all of this so that the medical staff doesn't have it. We cannot stay safe, and we cannot care for all of these people that are coming in because no one is taking this seriously. And I am being super transparent. I was one of those people that wasn't taking it seriously. But I'm here to tell you that you need to. We are literally making life and death decisions for people. And I'm telling you right now, please heed my advice and stay home. Stay home with your loved ones. Don't go out. Don't go to the grocery store. Don't go through the drive-thrus. Don't do anything that could put you at risk to have to see me at the end of the tunnel. I'm telling you, it's not worth it. And I don't know what I can do to save people anymore. And that is something that I've never wanted to say in my entire career. So stay home. If you have any extra resources, consider donating them. And to my coworkers and all the people in the healthcare field, environmental services, our police officers, and hi Molly, yeah, to our police officers and first responders, just thank you so much for all that you're doing. We're in this together. We're gonna fight this as hard as we can. And if everyone does their part, I think that we'll come out victorious. But consider donating supplies if you have them at home, and stay home.
This is not a vacation time. This is not something that it's time to plan a vacation. I've seen several people post to Facebook, my kids are missing their friends in school. Do you want to meet at the park for a kid play date? This is never going to end. And my truth is that you have the option to be at home and distance yourself. But the path that God chose for me as a nurse of 13 years, I don't have that option. And it seems like you can't understand or you can't grasp the warnings that are being given. The mask that we have to wear and the gloves and the precautions that we have to take are very hard. Behind my ears are raw. My hands are raw. And I see you congregating at gas stations, not taking it serious, and you find that this is a vacation for you. There's a reason you're supposed to be at home. Going to the grocery store, and I see you coming out with flowers. That is not a necessity. What you can't grasp, or maybe you don't want to understand, is hospitals have no more ventilators for people suffering from the COVID-19. They've just deployed 1,000 workers to build ventilators to send to the hospitals. There's no morgue space because of the people dying.
Hey guys, it's Ruth again, nurse from Barcelona. Basically, I would like to talk about how is it going here in Spain, here in Barcelona. I have few friends in different departments. I have checked with all of them. They are all nurses and they are going through hell on earth right now because, for example, in the emergency departments, they don't have cubicles to see any other kind of patients. Patients are isolated in cubicles, so they don't leave a space for anyone else to be seen by any doctors. We don't have the proper equipment. We don't have anything. We don't have masks. I mean, I have to recycle this mask for my entire shift. Maybe I will need it to recycle tomorrow as well because I don't have anything else. My colleague Yurema, she's working in intensive care and they have 5 ventilators. They are all in use right now. And every time someone gets really sick and they need another ventilator, they don't have, and they need to decide who is going to use it, who is going to live, and who is going to die.